Hello everyone, you're all very welcome to our webinar this evening. My name is Darren McDade and I'm representing ESCI, the Education Support Centres in Ireland. We're delighted to collaborate along with Jigsaw, the Centre for Youth Mental Health, in delivering this webinar on supporting student mental health and wellbeing in schools. So you're all very welcome. We have teachers and school staff who are tuning into this webinar from all over the country this evening, and we're delighted with the turnout. I'd like to welcome our panelists for this evening who are going to be presenting the webinar. First of all, I'd like to welcome Jenny Deering, who's a senior clinician with Jigsaw Cork and Tipperary, Erica Lawless, who's a senior clinician with Jigsaw Galway, Aisling Creighton, who's a youth mental health promotion officer with the Jigsaw Schools team, Anne-Marie Barry, who's the digital education coordinator with the Jigsaw digital team. And I'd also like to welcome Siobhan McGrory, who's the Director of Education and Community with Jigsaw, and welcome Maureen Murray, who's a Manager for Schools for Jigsaw. As I said, we're delighted to be collaborating along with Jigsaw as the Education Support Centres of Ireland, and we hope you get a lot of benefit over the session over the next hour. We will have time for questions and answers, so we would appreciate if you have questions throughout the session that you put them in the Q&A section within the webinar. So we won't be able to attend to questions that appear in the chat. So just to direct your questions in the Q&A, and there will be time set aside for your questions and answers. We will try our best to answer as many of them as possible, but obviously with a large attendance tonight, we mightn't get to every question. So we just appreciate your understanding with that. So on that note now, I'm delighted now to hand you over to our presenters for the first part of the evening. And that's Erica and Jenny. So I'll hand you over to Erica and Jenny now. Thank you, everybody.
Thanks very much, Dara, and it's great to be with you all this evening. Thanks for participating. So just to give you an overview of what this evening's webinar will be about. So we'll give an overview presentation of what Jigsaw is, the service that we offer, and the problems that we've noticed impacting on young people's mental health in recent times, particularly with a focus on during the COVID-19 pandemic. And the initial presentation will last for about 30 minutes, and then there'll be an opportunity to answer some questions that you might have to myself and Erica as clinicians. And then that'll be followed by a presentation on the Jigsaw Schools Hub by our team from there. We'd ask that with any kind of questions that you ask, we won't be in a position to maybe comment on specific young people cases. So just to keep them kind of more general, and that any information that I share about my work is that clients' details have been anonymized as well. And we really look forward to your participation and participating in the questions and answers. If there's any questions that we don't get to this evening, we'll follow up after the webinar with some kind of written answers to them. So who are we? So we're from Jigsaw, the National Centre for Youth Mental Health. That was set up in 2006 by Dr. Tony Bates, a clinical psychologist who'd spent many years working in St. James's Hospital with adults. And one thing he kind of noticed from his work was that many of the adults that he worked with said, oh, I wish I'd had that support when I was younger, or if, you know, I'd had someone to talk to when I was younger, maybe I mightn't have experienced as many challenges as that they did in their lives around their mental health. So with this in mind, he kind of set up Jigsaw back then. And our kind of vision within Jigsaw is an Ireland where every young person's mental health is valued and supported. And we aim to support this by kind of delivering individual clinical work to young people, a clinical service, also by delivering workshops in the community. So within the kind of clinical services, we're a primary care youth mental health service. So we provide one-on-one clinical support to young people aged 12 up to 25 years of age. And young people are at the focus of everything that we do. So when a young person comes into Jigsaw, we would work with them on the goals that they want to work on. So for example, maybe that might be for them to be able to answer, kind of put up their hand for a question in class, or to join that soccer team that maybe they've, you know, used to participate in, but have stopped because they've been feeling down. We work with young people experiencing kind of mild to moderate mental health difficulties. So for example, that would be things like maybe they've been feeling down, maybe experiencing high levels of anxiety. or been through a kind of a challenging time in their lives. With Jigsaw as well, there's no kind of minimum level of problem that a young person needs to be experiencing. If they think, do you know what, I could use for going for some sessions or talking to someone, we're open to that too. And we work with young people on a short-term basis. And the clinicians who work in Jigsaw, we're all from a variety of different backgrounds. So it's a transdisciplinary approach. So people might be from occupational therapy, mental health nursing, social work, psychotherapy, or psychology. So we recognise that kind of youth mental health, that it's a key issue impacting on young people. And within Ireland itself, we know from our own research completed, so the My World study was the largest piece of research done around young people's mental health in Ireland. The most recent one was in 2019. And from that, we noticed an increase in young people experiencing kind of higher levels of anxiety and low mood. So it kind of shows that it is a key issue for young people. And when we talk about mental health, how Jigsaw would view mental health is going to be described in the next video. And it's similar to how the World Health Organization describes it. So their definition of mental health is a state of well-being in that a person realizes their own abilities, can cope with normal stresses of life, can work productively, and make a contribution to their community.
Mental health is something we all have. It includes our thoughts and feelings about ourselves and others, how we relate to other people, how we function day to day, and how we cope with the ups and downs of life. Having good mental health is not about having no mental health problems. It's about feeling good enough about ourselves, being able to do the things that matter to us, and having the resilience to deal with the difficult situations we all experience in life. When talking about our mental health, it can be useful for us to think of it like a scale. Our mental health scale will move towards good or poor mental health depending on what's going on in our lives and the supports we have around us. There are things that can challenge our mental health and shift the balance of our mental health scale. These challenges can come and go over time. They may be brief or may last for many years. They can leave us feeling stressed, sad, worried, lonely, overwhelmed. Mental health difficulties rarely just have one cause. They're often an understandable response to having to deal with the circumstances of our lives and things that have happened to us in the past. While there are things that challenge our mental health, there are also things that can support it too. These things won't necessarily prevent challenges to our mental health, but they can help us cope with what life throws at us. They can help us achieve balance in our mental health scale. Mental health can be complex because our experience of it is personal and unique. But we know that the more we normalize conversations about our mental health, the easier it will be for young people and adults to seek the support they need when they need it.
So I think that animation really shows that idea that mental health is something that we all experience. So all young people have mental health, and sometimes it can tip over into being, poorer mental health, and at times maybe experiencing mental illness. And thinking specifically about the schools, there's many kind of protective factors that come into the school environment. It might be having that supportive relationship with the teacher. I know even this week, for example, one young person I'm working with who'd experienced a lot of anxiety had shared, we were talking about they were willing to go on a school trip and they were actually really excited by it now. And this was a young person who, had been avoiding going over, on trips and things. And I was asking them what's, the reason they feel able to now. And they acknowledged that it was finding out that this teacher that they got on really well with, that they're going on the trip. So they felt kind of more able to go on it then. Other kind of protective factors kind of within the whole school might be having that kind of pastoral care support, guidance and counselling support. It might be having that plan in school of how to deal with if you're experiencing kind of a panic attack or anxiety as well. Also kind of a culture within a school of belonging for all. So that could be maybe having like culture week, LGBTQ, all of those things are really protective factors that support young people's mental health. And then recognizing as well that there might be some factors at play that might put someone being a bit more vulnerable to experiencing poor mental health. So that might be maybe they're experiencing bullying in the school environment, or maybe they're a person who has a specific learning need or an intellectual disability that might make kind of academic work a bit more challenging. So maybe recognizing that might be a vulnerability factor and trying to put what supports are possible in place for them. And then kind of to think about as well that within the school environment there, you see young people every day, and it might be helpful to think about maybe what indicators might be there that a young person might be experiencing difficulty with their mental health. So for example, maybe appetite changes, maybe the young person is avoiding kind of going to the canteen at lunchtime, or maybe they're kind of repeatedly forgetting their lunch. Maybe they're experiencing higher levels of anxiety, and that might be seen by constantly maybe asking what if questions or seeking reassurance about kind of upcoming tests or exams, might be checking kind of the deadlines for homework again repeatedly, or maybe they might kind of be avoiding school on days that there's tests or presentations were due. You might notice that they're kind of demonstrating a lack of interest. So maybe they, used to really love being in the choir or playing on the football team, and they just have stopped doing those things, or stopped showing maybe an interest in their favorite subject that they used to really enjoy. So you might notice that they're experiencing kind of a reduced attention span. So maybe they're kind of constantly zoning out in class, or their kind of written work might kind of come up a bit ad hoc or no logical structure to it. You might notice maybe some signs of potential self-harm. So maybe they're constantly wearing long-sleeved clothes, even in really hot weather. That's a bit different. Or maybe you notice some marks or scarring on their body that might be unexplained. You might notice that they're demonstrating more sadness, so maybe more tearfulness. Maybe their posture is kind of more hunched over, or avoiding eye contact. They might be more irritable, so maybe not kind of constantly oppositional in the classroom, or not able to take any direction. So these are just some of the things that you might notice that maybe a young person in the school is struggling with their mental health. This is taken from our kind of website, Jigsaw, and it just kind of demonstrates kind of the presenting issues. So the things that young people come to Jigsaw for support with. So the kind of top kind of things that young people who attend our service will come with would be low mood, anxiety, stress, and changes to kind of their sleep as well. So I thought that was just kind of interesting to think about all the different things that a young person might come to Jigsaw for support with. And then kind of some things that we've noticed as clinicians that kind of have increased following the COVID-19 pandemic. We'd have seen kind of an increase in disordered eating difficulties, and I think kind of anecdotally it seems to be that, during the last 2 years, maybe a lot of things and factors were outside of young people's control. So maybe eating was one of the things that they did have some control over. An increase in health anxiety, so a lot of worry about their own anxiety or the anxiety of the health of other family members or friends. An increase in kind of anxiety in social situations, and even, for example, a young person who was very anxious about not wearing masks anymore, and kind of feeling anxious about how their facial expression would come across or to other people when that happened, and being quite anxious about going on mask breaks and things. And with that young person, I would have worked on a gradual basis with them to try and support them to get used to not wearing them anymore, kind of feeling down or unmotivated. And again, an increase in kind of self-harm behaviours. And it's recognising that the last kind of couple of years have been challenging for all, and particularly for young people, and also that they've been extremely resilient during that time too. And kind of some particular challenges that we've noted is kind of that transition from primary into secondary school for young people who have transitioned into that in the last couple of years, that maybe not having the opportunity for those usual endings that would have normally happened. For the current kind of 6 years, many of them might have had the experience of sitting a formal exam, and that can be more kind of anxiety provoking. The move to online learning, and one area we kind of noticed was that for some young people, maybe in some different backgrounds, mightn't have had as easy access to the internet or computer, or maybe their family members mightn't have the IT skills as well, so that was a challenge. Whereas for some other young people, they thrived on it and really loved it. Also noticing maybe an increase in school avoidance following kind of the return to face-to-face learning, or finding it really difficult to get back into that environment. And all the changes, like all of us, in the structure and routine of their weeks. So now I'm going to pass over to my colleague Erica, who will finish the rest of the presentation. Thank you.
Thank you, Jenny. I'm going to chat a little bit about addressing mental health and well-being in schools. And I suppose just to note, it's not a prescriptive guide. I know sometimes it can be easier if it is, but I suppose there is no one size that fits all. But it can be about, I suppose, looking at these, at what we're talking about today, and adapting them to kind of meet the needs of your school and your students. So based on some of the research that Jigsaw has carried out, and from working with young people coming into the session rooms with ourselves, and some of the difficulties that they're bringing to us, we'll discuss how some of these might be supported in schools. So first of all, looking at a whole school approach, these are 4 key areas that are noted in the Wellbeing Policy Statement and Framework for Practice by the Department of Ed. So keeping in mind some of the difficulties that young people come to us with, I'll talk through these 4 areas. So first of all, the culture and environment of a school, as part of a whole school approach, looking at the culture and the environment. Does it support positive mental health and well-being? Looking at the mission and the ethos of a school. Is well-being at the core? The mission and the ethos and the culture of a school, it can really feed into a student's sense of belonging and sense of connectedness to their school, which then in turn can impact their mental health and well-being. Many students who do enjoy school, they might, and experience good mental health at school, they might feel connected to a certain part of their school day, and there might be a certain aspect of school that they really feel connected to, and whether that's the academic aspect, that they get on well academically and they enjoy positive feedback from teachers, or it might be some extracurricular activity that they do well with and they connect with, such as sports or music or debating. Or it might be social connections that they look forward to going in and seeing their peers and connecting with peers. But I suppose there's just some aspect of the school day that they feel they connect with, and they have a purpose and meaning being there. And I suppose on the flip side, then there can be students who really struggle with attending school, and maybe they don't feel that they connect with school, or that they don't feel they really belong, and therefore then they don't see the point in going, if they feel that they're not really connecting. And with regard then to the physical environment can be really impactful. So having students involved in the physical environment in school, so they feel it belongs to them. Here in Jigsaw, we have our volunteers, the youth advocates, and they advise us by bringing kind of a youth voice to the decision making within our service. And they've always had an influence over the years on our physical environments. And many young people often comment that within our Jigsaw buildings, the physical aesthetics, that it's quite friendly and warm and welcoming. It's quite colourful with soft furnishings, and I suppose that was the youth voice that would have influenced us in that way. So yeah, I suppose the importance of youth voice and student voice, it's important that is heard. And just within the school climate, that there's a sense of security and safety, and that might be, supervision on the corridors, but just that students feel safe and secure within their school environment. And then looking at the curriculum, I suppose with the academic side, in addition to the kind of more obvious ones like having learning supports for students with learning difficulties, also that a focus is given to providing opportunities for success and providing opportunities to boost self-esteem, incorporating different learning styles, project-based work and practical work to highlight different strengths, and catering for different learning styles through different maybe multisensory approaches to teaching lessons. Also within the curriculum, I suppose praising efforts that there's mental health literacy within the curriculum, and again placing emphasis on extracurricular activities that are important too. And then with policy and planning, just that there are whole school policies for wellbeing promotion, that all policies are relevant to wellbeing, having policies and approaches to prevent bullying, having support structures for staff, such as having care teams, having fair behaviour management and disciplinary policies, and sometimes explaining to students why these are important. So yeah, wellbeing can be relevant to policy and planning also. And then lastly, relationships, and I suppose we do emphasise this one a lot in Jigsaw. Relationships and connection, they're really key. We talk about the one good adult quite a lot in Jigsaw. The theme of one good adult came from the My World survey, so the national study on youth mental health in Ireland. And one good adult, it refers to an adult in a young person's life who they feel that they can turn to for support. And often that one good adult is a parent, but also quite often it can be a teacher also. And having one good adult was identified as a protective factor for young people's positive mental health. And so many young people within the session rooms with us in Jigsaw in our sessions talk about the impact of teachers, often getting to know young people. I might ask, what's their favourite subject in school, and they may, give an example, for example, history, and sometimes I'd ask, oh, what is it about history that you like? Is it that you've always been interested in past events? And they might kind of have a think about it and say, oh, I just really like the teacher. Or similarly, we'd have a lot of young people coming into us that might have difficulty attending school. Quite often it might be social anxiety, just finding it quite overwhelming. And we'd be trying to, I suppose, find little parts of their day that maybe aren't so bad. And I'd ask, well, is there any part of the day that you're not feeling too bad, or that isn't so bad? And sometimes, again, they might mention a subject. And, quite recently I had somebody that mentioned a subject, and I asked, that going into a certain class, felt kind of nice. And again, I asked, what was it about that class? And they said, oh, the teacher really likes me for some reason. So I just, found it interesting, just the impact, of the relationship with teachers. It really seems to impact their mental health in school. And I suppose on to more kind of individual practical strategies. The Jigsaw developed this concept of rally in consultation with young people, consulting with young people about what it was about their one good adult that they did find helpful. And these points: recognise, acknowledge, listen, let someone know, your response matters. These come out from that consultation with young people. So firstly, recognising, so recognising signs of distress, recognising something is up. Earlier in the presentation, Jenny mentioned just the different signs that we can look out for that a young person is struggling, maybe noticing changes in their behaviour, noticing frequent absenteeism. And recognising can go hand in hand with acknowledging as well. So it's after recognising something is up, acknowledging it with a young person. The power of acknowledging and validating, it really can't be underestimated. Just noticing what somebody's going through and showing understanding and showing empathy. Sometimes that can be all that somebody needs. Often young people might not actually be ready to open up. They might not be there yet, and actually sometimes all they might need is somebody to just acknowledge that they're going through a difficult time. They don't always need, you know, the problem to be fixed or solved. They often just need somebody to be there. And, you know, there can be a time and place for collaborative problem solving and a solution focused approach. For example, you know, if a young person is maybe stressed about exams, there can be a place for, you know, helping them with a study schedule or timetabling, or breaking down the problem. But quite often it can be actually just acknowledging, validating, showing understanding, and that brings me on to the next one, listening. So listening in a non-judgmental manner, or, you know, not necessarily trying to jump in and fix it, but just listening. And the next point, letting someone know. So I suppose it's important to have an awareness of additional support options and when to seek additional support. And that might be sending onward referrals for, you know, external agencies or additional supports such as Jigsaw, or other support services, or it might be letting a parent know. Sometimes young people might, you know, be upset at the thought of letting someone know, like letting a parent know, but you know, quite often when it's explained to them as to why it's important, and we would find that in Jigsaw too, that, you know, they do usually understand when we explain why it's important that we need to let someone know. And I suppose also for yourselves, letting a colleague know. Often it, you know, some information that we get, it can be too much to hold for one person, so you may need to let a colleague know. And then just finally, your response matters. So I suppose that relates to remaining calm, remaining non-judgmental, the above points, just acknowledging, listening. Yes, it is that relationship and connection that's really, really important when a young person is struggling with their mental health. And next, I suppose just to point out, as part of a whole school approach, teacher self-care is part of a whole school approach. I suppose we're here to discuss supporting students' mental health, but a really vital part of a whole school approach is looking after yourself first. Working with young people can be depleting and draining if you already fulfill a lot of other duties as part of your role. Supporting young people's mental health, you know, it may feel like an additional task if you're already really stretched and really exhausted, and it can be a balancing act at times. But within any helping profession, and in particular with teaching, because you're dealing with so many students per day, that it's really, really important that self-care is prioritized in order to prevent burnout and to be able to continue to help and support. So it's important to be aware of your own stress or triggers, kind of knowing your own early warning signs to feeling exhausted or depleted, and having a list of nourishing activities or things that promote well-being for you. And also it's really important to maintain boundaries, and I suppose knowing when to seek additional support and knowing, you know, when to say no. We have a self-care for teachers workshop on our Jigsaw online platform as well. So I suppose having the whole school approach, and there are structures in place to support mental health and well-being of students, and it, you know, I suppose as I've mentioned, it's not up to one or two individuals. It is a whole school approach. But it's important to know when to seek additional support. So this is just to give an idea of the mental health service framework. So at the bottom of a pyramid here, the bottom represents the community support. So that's including informal support such as family, friends, self-help, other community groups, and that also includes you as teachers and the school support, supporting the students. If a young people needs more specialist care, additional support, the next tier is the primary care. So that would include GPs, and primary care also includes public health nursing, primary care psychology, social work, SLT, OT, and Jigsaw also fits into this primary care tier. So Jigsaw dealing with mild to moderate mental health difficulties is the primary care level. And then sometimes young people may need more intensive intervention, more specialised support, and that would be the secondary and tertiary care level. So the secondary care level would include CAMS, the child and adolescent mental health support, and the adult mental health services, and the tertiary care then would be the inpatient. So this pyramid, it resembles, as you may be used to, the NEPS continuum of support model. So with the bottom being representing support for all, and then the middle representing support for some, and then the top is support for a few. So one of the aims of Jigsaw when it was being established would be that it would be an easily accessible service, that young people wouldn't need only professional referrals to receive supports in Jigsaw. So it is quite easily accessible. It's a free service, and young people who are over 18 can self-refer by phone, by email. Young people under 18, they can, parents can refer themselves. Parents can phone in or email, and professionals can also refer using our referral form. So schools can refer, and then also young people can be signposted from using the jigsaw.ie, the online services. And this is just a list of a range of supports and services on jigsaw.ie. So we have our live chats, our group chats, our question and answers, and we also have a number of resources for people working with young people, for parents, and also for young people themselves. So that brings us to the end of our presentation, and I'd like to invite anyone to ask any questions. So I'll stop sharing my screen now.
Okay, great. Thank you very much, Jenny and Erica. I've been keeping an eye on the chat there and on the questions and answers section as you were going through your presentation. So there's a few questions in. I mean, one of them actually was just that you, as you had spoken to there, Erica, about how young people can get in touch with Jigsaw and how they can make an appointment and can they self-refer. So I think you've covered that. I suppose just to clarify that there are 14 Jigsaw services around the country. So unfortunately, we don't have a Jigsaw service in every county or in every community. And I had just put a note in the chat there to say that all the information for where the services are located can be found on jigsaw.ie and full kind of list of the services and how to contact those. There were a few other questions, I suppose, just linked to that piece in terms of how a young person can get in touch with Jigsaw. You know, how to speak to a young person about what they might expect from an initial appointment with Jigsaw, if either of you want to take that question. So if there is a Jigsaw and you know, in a particular area and a young person refers themselves or the school refers them, what might a teacher or a member of school staff say to them in terms of that first appointment?
I can start off, and then maybe Erica, you can jump in. So for that kind of an initial appointment, what we do in Jigsaw is we offer a screening appointment. So that would be usually about 30 to 40 minutes to meet with the young person, and if they're under 18, and a parent or guardian. And really that's an opportunity for us to kind of share more about what Jigsaw is and the type of service that we offer, and then to hear a bit more from the young person and what they've been experiencing and their challenges, and just to see if we're a good fit for them and that we'd have a plan by the end of that session of moving forwards. So that would be really it, and that'd be very led at what the young person wishes to talk about. Just to say as well, for maybe young people who don't have a Jigsaw in their area, the Jigsaw online is available to any young person in Ireland, and that includes that one-on-one clinical support via chat with the clinician. So that might be an option for those young people who don't have a face-to-face service in their area.
Super. There's a very specific question that just came in there. is bulimia a sign that a child needs to go to Jigsaw? So maybe you want to speak a little about the scope of practice there, either Jenny or Erica.
Yeah, well, I suppose if a teacher felt that a young person, if they had information that a young person had bulimia, we suggest the teacher recommending that the parent bring the young person to the GP initially. The GP is usually the first point of contact. So in Jigsaw, we deal with mild to moderate mental health difficulties. So usually when young people would have eating disorders, they usually would be referred to CAMHS, so the Child and Adolescent Mental Health Service. So CAMHS would typically deal with eating disorders. Now we do see young people that might have some issue, maybe have some anxieties around body image, or there might be emerging signs that they're kind of watching their food, and there might be certain thoughts or anxieties around food. But when we see that this is an eating disorder, they would be typically referred to CAMHS for that more moderate to severe mental health service.
Okay, thank you very much. There was another question there about, do we give talks in schools? And I see there was a specific question that came in terms of talks or Zoom chats in Limerick. So as I said, the 14 services around the country, we have and we do work with schools in those areas. We've got one very particular specific programme of work, which is a comprehensive programme of work called One Good School. And at the moment there are over 150 schools involved in that, but they've signed up for a 2-year process with us. So just the other piece to say, and we will be coming on to it in a few minutes, is for all other schools who aren't involved in One Good School, we have our Jigsaw Schools Hub. So you'll be hearing a little bit more about that now in the moment from Aisling and Anne-Marie. There was also just a very specific question about any recommendation that you'd have for working with 8 to 9-year-olds that are struggling to build and maintain friendships. Now, I know that age profile is kind of outside of our age profile, and that we work with young people 12 to 25. But just any thoughts you might have on that particular question from your experience, girls?
Jenny, you might have some ideas as well, and I suppose it can depend in the area you're in. I know sometimes primary care psychology or the different disciplines within a primary care with the HSE service sometimes can offer really nice programs. I know there's a nice program, the Friends program, that sometimes NEPs run with teachers. Again, it can completely depend on the area. NEPs often run that program at teachers, and I have heard of that program being run within the HSE, like a primary care psychology. Again, it can depend if the person has access to those services. So I'm not sure, Jenny, if you have any other suggestions there of programs that you would know about.
I think even sometimes maybe just observing how the young person does socialise or engage, and maybe just taking a step back and observing it, and then maybe trying to support or see, okay, do they do better when it's maybe a task related engagement, or maybe breaking it down into smaller groups, and then really role modelling positive kind of behaviors or engagement, or what a good friend is, what does that look like, and just really modeling with the young person those pieces, or finding something that they're interested in. Maybe they're really creative, and maybe supporting them to engage in those type of activities, or maybe they're more sporty, just as a way to try out to start with.
And I'll just take 2 more because I'm conscious of moving on to the next part of the presentation. And as we said earlier, if there are any questions that we haven't answered, we will certainly put the answers together and get those sent out to you. And particularly there are some names, people have added their name to the questions, so we can take those and contact you directly. Do you have any advice about school refusal?
I think that's a really common piece that comes up for people, and I think it's really kind of a whole team approach really for it, like working with the school, the family and the young person themselves. Like sometimes it might be returning to school on a graded fashion. So maybe going back for maybe the preferred classes, or if mornings are the time maybe that they function better, then going in at those times and supporting that. Or maybe the opposite could be true. Maybe the afternoons are more manageable for that young person. So trying to kind of work flexibly for a plan around it, or sometimes as well having a safe space within the school environment for the young person, that they know they have permission to go to that space if needed, if their level of distress gets higher during the day, that might be a way of that they have that space to go to and then return into the classroom. Because it is really that piece on trying to put supports in place in that school environment to enable them to attend rather than avoiding fully, because we know that kind of avoidance does maintain the problem for people.
Mm-hmm.
And just the last one I'll take here then is, have you any tips for breaking stigma, in particular for boys to open up or to seek help when they're struggling? And then this person has alluded to, unfortunately, a suicide of a student in the last few weeks. So a very upsetting situation for the school. But I think particularly the question is around trying to encourage boys to open up and to talk more about mental health, which I think in Jigsaw we're all too familiar with in terms of that issue. So
yeah, and I think just really opening up the conversation about mental health, and that we all have mental health. Everybody has mental health. You know, we often say in Jigsaw, you know, just like we physical health, we've mental health, just like we have dental health, we've mental health, that we all have it. And like in Jenny's presentation, it's on a spectrum from, you know, some days it can feel, our mental health can feel poorly, and other days it can feel good. And really just opening up that conversation as much as possible, trying to include it into the curriculum where possible, into the classroom, having open discussions. You know, some classes it's easier than others, like SPHE, that can come in quite naturally. But even having different initiatives around the school, you know, having mental health weeks to encourage people to open up a little bit more, and even on things like mental health weeks, having, you know, notices up, and having flyers up, having representation of mental health services such as Jigsaw in schools.
Yeah, and I think even sometimes maybe one way of kind of opening up the conversation might be even just to acknowledge to a young person. So like maybe to, like, I know that, or I think maybe the last few weeks have been really difficult for you. Just to let you know I'm here for you. Is there anything I can do to support you? So sometimes even just one-on-one, maybe opening up the conversation with that young, you know, with the young men. Or I think men in general kind of seem to open up more with doing something. So maybe it might be actually engaging in a task or activity, and the conversation maybe coming up as you're doing it rather than face to face. I think it's the men's shed kind of have their analogy around mental health, is that kind of women, we might natter face to face, but with men, I know it's very cliche or gender, but that men more kind of open up side by side. So that might be a way, particularly with young men, maybe to talk about it. And I think it's really, like Erica said earlier, like being aware of your own kind of body language or your own response as well, and trying to keep it as non-judgmental in your approach with the person, and kind of saying to them, you know, having that open door policy, that they know they can come back to you, and giving them that choice as well. Or sometimes even just asking permission, you know, is it okay if I ask this? Or is it okay with me? I just want to check in with you. How does that sit with you? And the other piece, maybe just to say in relation specifically around kind of suicidal ideation, or being experienced in the school, Pieta House are another kind of organisation within Ireland that offer free support to young people of any age too, and who've been bereaved by suicide as well. So that might be one other organisation maybe to consider linking in with.
Okay, thank you very much, Jenny and Erica. We're going to move on to the second part of the webinar now, a shorter part, but I'm going to invite Aisling and Anne-Marie to pick up here and to share their screen. So over to you guys.
Okay, good evening, everyone. My name is Aisling and I'm the Youth Mental Health Promotion Officer for the schools team in Jigsaw, and I'm joined by my colleague Anne-Marie Barry, who's the Digital Education Coordinator as well. So we're going to be talking to you today about the Jigsaw Schools Hub, We're going to give you just a quick overview of what the Hub is. We're going to show you some of the resources that you can find on the Hub, and give you a quick tour of the Hub on the website. And we will talk you through, I suppose, the user data today and what's next for the Hub as well. So firstly, just to give you an overview of what the Schools Hub is, it's a national digital platform which was launched by Jigsaw in 2021. And it's available to all school staff in Ireland who have an interest in promoting mental health in schools. So we hope to do this by providing staff with access to classroom resources, e-learning materials and information that have been developed by Jigsaw. And we have a link to the Hub as well, and Anne-Marie is going to share it in the chat. So just to give you an idea of what the aim is of the Hub, the overall aim of the Schools Hub is to enable school staff to promote and support mental health and well-being in schools. So we hope that they can achieve this by providing them with resources. We have, first of all, classroom resources that staff can use in the classroom with young people. And these resources can help build the mental health literacy of young people. They will support them to better manage their mental health as well and develop health seeking skills. And as well as the classroom resources, we also have resources available to school staff to build their capacity to promote mental health in schools. So in Jigsaw, we know it's really important to build the capacity from within the school system. So we have resources available that can help build staff's confidence in that area. So I'm going to just show you some of the resources in a bit more detail now. So firstly, in terms of the classroom resources, we have a couple of different things in the Hub at the moment. We have our Youth Mental Health Toolkit, and the aim of this toolkit is to build mental health literacy and develop health seeking skills among young people. We also have this toolkit available as Gaeilge, so all the resources are available in Irish, and we are hoping to translate more of our resources into Irish in the future. And we have a school transitions toolkit as well. So this is designed for primary schools. So it supports 6th class students with the transition into post-primary school. So you can see on the right hand side there, we have a couple of different examples of the resources you might find on the Hub. And we just kind of want to, I suppose, emphasize that there's a variety of different resources there. So we have interactive multimedia resources like animations. There's worksheets you can download that the young people can fill out in class. There's prompts to create discussion around topics in mental health, and many more as well. And I will be showing you some of the resources on the Hub very shortly. And then in terms of the resources available for staff, there is stuff there to build staff's capacity as well to promote mental health in the classroom. So in terms of what's on the Hub at the moment, we have guidance videos and documents. So this can help prepare staff when they're about to deliver one of our resources in the classroom. And there is reflective practice templates as well for them to reflect on what they learned as well afterwards. There's e-learning courses as well for staff. So we have our Supporting Wellbeing in Schools course, and we also have our Self-Care for Teachers course as well in the Hub. There is different information for school leadership and how to support the other staff's well-being as well. There's self-care information for school staff in general. And we also have a monthly newsletter which shares updates of new material that's been added to the Hub. So what I'm going to do next is give you a quick tour of the Hub. I'm just going to have to briefly stop sharing and then reshare. So this is the landing page of the Jigsaw Schools Hub. So I'm going to very quickly just show you what it looks like, and then go into some of the resources. So if you follow that link, it will bring you to this page. And from here, you can navigate to all the content that's on the Hub. There's a list of the content here on the left-hand side. We have an introductory video from a post-primary teacher as well, describing her experience of using some of the resources. And then further down, there's more information on all of the content as well. So we have our mental health and wellbeing toolkit, the e-learning information for teachers, information on self-care, information for school leadership, and our school transitions toolkit as well. So what I'm going to do now is just show you one of the sections of our youth mental health and wellbeing toolkit, section 4, just to give you an idea of some of the resources that are there. So this section is about managing feelings. Really, it's to help young people to develop their emotional vocabulary, understand and validate their feelings, and also to look at some strategies to manage some of those more difficult feelings. So I'm going to scroll down and go to strategies to manage feelings. And these are some of the resources we have. We have our ACE technique, which is an animation about grounding. We have downloadable resources that you can share with young people on tips to manage feelings. We have our animation on breathing techniques. There's worksheets as well that they can download and fill out in class. And we also have videos of real life young people sharing their experiences as well, and some tips on relaxation. So that's really just to give you a bit of a flavour of what's on the hub. So I'm going to stop sharing now and pass you back over to Anne-Marie for the rest of the presentation.
Okay, so I'll just quickly introduce myself again. I'm Anne-Marie Barry. I'm the Digital Education Coordinator with Jigsaw. The Jigsaw Schools Hub is launched in March 2021. And since then, we've had over 21,000 users. It has a geographical spread all over the country. User rate satisfaction is quite good. And since September 2021, we have added bite-sized information from the hub. As you can see from the sections, there is a lot of content. So from the newsletter, we've been adding bite-sized information, which has increased engagement in toolkit sections such as managing feelings, which is can be quite a heavy topic, but one that is quite crucial as well for young people. In June 2021, we launched the Primary Transitions Toolkit. I think Erica or Jenny were talking about that difficulty of transitioning from primary school to post-primary secondary school. So we have the toolkit there. And the promotion of upskilling with new e-learning courses began again as well in August in 2021. These were highlighted in the newsletter. And from say September, we realized there was a different need and want from the user. And that user would be you guys. So what is next for Jigsaw Schools Hub? We're adding new content all the time, but we need to be user informed as much as possible. Therefore, consultations with you is really important for the update of Jigsaw Schools Hub, which an update is currently underway. So as a result of recent consultations that we have had, we are looking at enhancement to the layout of the hub and new and revised content in line with curriculum. But we do have an ask of you, and that is, we invite you to get in touch with me. My email is on the screen there. I think Aisling will share it in the chat, to be part of a community of practice panel. The panel will focus on your needs on Jigsaw Schools Hub, and they will be informed by your interest in mental health and well-being, and the mental health and well-being of young people as well. The time commitment of this it's actually quite low commitment, but we'll have occasional meetings over the next 3 months, which will bring us up to June. Date of the first panel and platform, we might use Slack or a private Facebook group will be confirmed. And then basically it'll be 30 minutes of live chat with me and Aisling, and you will be part of the Schools Hub further development. So I hope to hear from a lot of you, and thanks for listening.
Thank you, Anne-Marie and Aisling. Just last chance there for any questions that anyone might have in relation to the Jigsaw Schools Hub specifically. I don't see anything coming in specifically in relation to the hub, but as Anne-Marie said there, we really would love to have an opportunity to link in with you and any of you who are interested in being part of that panel. We would be absolutely thrilled to have you on board to help us to kind of redesign and to look at how we can further develop the hub to meet the needs of teachers and school staff across the country. So I don't see any questions coming in, guys, so we might invite Dara to come back in, if that's okay, to finish off the webinar. Thank you very much.
Absolutely. Look, I just want to say a special thank you to all of our presenters this evening. On behalf of ESCI, we're delighted to have this collaboration with Jigsaw, and I think that, you know, listening in over the last hour, there are so many supports and resources that are there for you as teachers, for you as schools, and, you know, for you as other members of society as well, as parents, as brothers, as sisters, as connected to young people, anybody connected to young people. The resources and the supports are there, and obviously they've given lots of information there. And just like to echo that point towards the end there that Anne-Marie was making in terms of getting in touch with them in relation to that panel. We would love to see teachers engaging with that panel, because you have a chance now to have an input into the supports and resources that are developed. And I think that's been one of the strengths of the collaboration between ESCI and Jigsaw over the past number of years, indeed 10 years of a collaboration, is that input that teachers can have into the supports that are put in place. So we would echo that and encourage you to get in touch with Anne-Marie. The email address is there. Just want to say a special thanks to Erica, to Jenny, to Aisling, to Anne-Marie, to Siobhan and to Maureen in the background as well, and to everybody at Jigsaw for the preparation of the webinar this evening, and for all the supports that go into that. I'd like to thank you all for that. I'd like to thank all the participants for tuning in this evening. We had over 150 people who tuned in this evening, so that's an encouraging sign that people are willing to give up of their free time on a Wednesday evening to tune in to see how they can support young people in their schools and in their communities. So look, on behalf of ESCI, I'd like to thank you all again, and there'll be an evaluation for the webinar which will pop up straight afterwards. We will be in touch with you in the coming days with the presentations from tonight. The webinar as well is going to be, as has been recorded, and will be available to view on the ESCI and Jigsaw websites over the coming days. So keep an eye on that too. And please share the word among your staff, all of the people in your school community, of all the fantastic resources that are there, in particular the Jigsaw Schools Hub. And we're delighted to have that. So yeah, I think that's all the comments I have at the end, just to thank everybody again. Siobhan, unless you have any closing comments there from Jigsaw.
No, just to say we're delighted to be involved, Dara, as you know, and to work collaboratively with yourselves, and you know, look forward to future opportunities, and particularly to this piece around the panel and so on. So look forward to seeing everyone again, and thank you so much for attending this evening.